Welcome to Brainstorm9000.
You got a brain? Your brain wants to listen to this podcast.
So open your brain.
Hello, Internet. We have yet another episode of Brainstorm 9000. This time it's a full deck. Hermes just came down to earth. Hi, Hermes.
I'm back. How you guys doing down here?
How does it feel to be back?
It's all right, you know?
Yeah?
Yeah.
Better on the Mount Olympus?
It is, but I'm like one of those, what are they called, like winter birds?
Right.
Like when old white people go to Florida and then they come back to New York when it's
Yeah,
warm
yeah,
and
yeah.
they go to Florida. Is it called winter birds?
I don't know.
Snowbirds? Snow something?
Yes, probably.
Okay, cool. I don't know.
Today
One
with
of those.
us, we have a doctor. So I'm a doctor, but I'm not a real doctor. I'm a psychiatrist. And we have a real doctor. Hi, doctor. Your name is Dr. Diamond, right?
Dr. Diamond.
Okay.
Ooh.
Just for people to realize, we are hiding the actual identity of this physician because today I suggested we talk about doctor abuse, meaning not doctors abusing other people, but other people abusing physicians. Hermes, do you think it happens?
I mean, as a doctor, you know, I go through this kind of work all the time with my
Right.
patients, so
Right.
it definitely does happen. I'm glad we're finally talking about it. I think we've been sweeping it under the rug a bit too long.
Because, I used to have a different co-host. Her name on the show was Master McMaster because her last name is McMaster and she has master's degree in philosophy. She was an
Oh, wow.
amazing host. And if you guys never heard any episodes with her, I highly recommend you go back and take a listen. It was very good. When I introduced this idea to her, like almost a year ago, that I said, hey, shouldn't we talk about doctor's abuse? She said, well, aren't you guys a bunch of rich people? Who never. So, Dr. Diamond, what do you think about?
I don't think so. I'm a resident right now, so
Right.
I would say the opposite.
Right. Do you think
So
you feel that you are being abused?
definitely.
From what directions?
I think all directions. Administration, the hospital, patients.
Right.
It comes from every angle.
Well, you forgot one very important angle because you are actually very fortunate and don't have to deal with it yet, but it's also insurance.
Insurance
And there are
companies.
two types of insurances, actually. One that people are aware of. Like in this room, we have quite a few people around us, some of whom might or might not have medical insurance. But remember Obamacare and stuff. So when people were supposed to have insurance, which insures you in case you need to see a doctor, you can go and see a doctor, right? And it pays. But we doctors, unbeknown to a lot of people, also have our insurances, or should we say it in plural, insuri, right? We have insurances that are called malpractice insurance. Like if, God forbid, somebody has a problem with one of us and starts suing us, malpractice insurance sends its lawyers and starts talking to them. Hermes,
What's up?
what specialty do you think in medicine has the highest insurance rate when it comes to malpractice?
When it comes to malpractice,
Like who has more lawsuits? What specialty?
I feel like a psychiatrist.
Okay.
No, because I feel like if you mess that up,
Right.
yeah, people are just be like, "Oh, you messed with my head," and it's
Right.
kind of like, how do you prove or misprove
Well,
malpractice? in
I
that?
can tell you, Hermes, that as always, you think very highly of psychiatry because you are super intelligent, right? You
Mhm.
are God.
Mhm. I'm out here, you know.
But actually, Dr. Diamond, do you know what specialty has the highest rate?
Is it OB-GYN?
Yeah, it's
So,
OBGYN. So
OB-GYN.
uh,
Makes sense.
obstetrics and gynecology. So just for the brains of the internet who probably don't think anything lower than their neck, I would like to explain to you that obstetrics means that you deal with delivering babies. So if you let your imagination go wild, you can imagine how many issues can be either created around it, right? Or
Yeah.
there could be mistakes.
And I think it's up until the age of 18, so there's a long time for the possibility of lawsuits to occur.
Obstetrics.
hmm
I
Yeah,
feel
it's
like
from childbirth to 18 that they can.
Really? I didn't know that. So there's no gynecology until you are 18.
No. I mean, if
oh,
anything
like
goes
the
wrong,
statute of like limitations.
right,
Ah.
yeah.
Oh, okay.
So
So
say someone's 15 years old and they have a problem, they could technically sue their obstetrician.
Okay, but the obstetrician is who's taking care of the mother of a baby?
No, the one
Then
who delivered the baby, and I don't know when their responsibility stops because it gets very complicated. Like, for example, the woman is in labor, right? Right? I mean, other than a character who was played by Arnold Schwarzenegger, man did not deliver. Remember, there was a movie with Arnold where he was
where he
pregnant.
had a baby.
Yeah, he
Like
had, yeah,
big
yeah.
belly
Well,
Arnold.
he was pregnant in the
What
movie.
was that movie?
I don't know. His
Yeah, there was a
imagination's
movie
running
with him
wild
being
at this
pregnant.
point,
Yeah,
I
yeah,
think.
yeah, yeah. So I actually don't know where the responsibility of obstetrician stops. Do you know?
I heard it was until age 18.
No. But for example, so the woman is delivering, right? Arnold is out of the picture right now.
Okay. Arnold could be
And
delivering.
the baby is coming out. So the baby came out, and then that's it. No obstetrics anymore, or there is more. Do they take care of a baby also immediately upon delivery?
No, then it's
Micro
pediatrics.
pediatrician.
Yeah.
Okay, so then there is a micro pediatrician. Okay, so OBGYN, and then GYN is gynecology. Use your imagination. Okay.
Okay. That'd be really hard.
For example, easy things to imagine: abortions. Tons of things can go wrong. Complicated surgery. Right. A lot of things can go wrong. So of course, for children, meaning delivering children, people sue like crazy. I'm not suggesting to our audience to start suing the hell out of doctors, but it does happen. Sometimes it happens for a very good reason. We both, probably Dr. Diamond and I, could have told you the stories of amazing mistakes that people have made, right?
Oh, yeah.
Like what?
Day to day.
Really?
Okay, so you're supposed to inject the left arm, you accidentally do the right, or worse, you're in the OR and someone does a surgery on the opposite limb.
Yeah, OR is operating room, right?
Or,
It does
or
happen.
It's a
leaving
huge
something
mistake, yeah.
in the sterile field.
Right. So I do see people, right, as a psychiatrist, and I've heard horrible stories, and in developing on some of the stories I participated. Like, for example, I can tell you that as a psychiatrist, I used to get consulted when I worked inside of the hospital, and still get consulted on cases when somebody who is in very good shape all of a sudden becomes what people consider to be crazy. For example, I had to deal with a case about 6 months ago when a woman brought her husband in after this husband, who is 70 years old, was seen by numerous general practitioners, a neurologist, and the reason for him to be seen was this: until that time, he was doing great. So the guy was a very sophisticated engineer. He also was a very sophisticated, very successful businessman. He played sports, he played chess, and then he played a game that is very popular in the Middle East. I'm not going to talk about it. It's very complicated, right? Was basically a funny guy, a very good dancer, a very popular guy. And all of a sudden, he started forgetting names of people, forgetting the date, losing his way on the street. That's what drove people crazy. So they brought him to a general physician who did just a general blood study, didn't find anything, and said, he's totally fine. If you want, I can do a EKG, a cardiogram, right? Which they did, and they didn't find anything else. Then they brought him to an older neurologist who looked him up, spoke to him, and said that, you know what, I think that he's becoming psychotic, bring him to the physician. So they brought him to me. See?
Yeah. They
So
missed
say what
it.
you are thinking.
Dementia.
Well, so they
Some
were thinking
neurologic
about dementia. See, so we have another physician here who, luckily for everyone involved, has not seen this physician, with all due respect. I mean, this patient. So I'm a psychiatrist. I understand that if somebody has sudden changes of their mental state without any obvious reason, you need to first, what we call in medicine, to rule out physical reasons for what's going on. So I actually, when she called me and told me that she would like to bring him, told her that, you know, he needs to see another neurologist. But they insisted, they said, he also saw a psychologist that is probably dementia, or maybe he is depressed. So he came to me, I heard the story, I saw that he is grossly disoriented, and I told them on the spot that they need to pick him up and bring him to the emergency room of a reputable physician. They did blood work, right? And it turned out, and they took his spinal fluid. He had encephalitis.
What is that?
It's an inflammation of the brain. Unfortunately for him and his family, it was viral. So as we speak right now, he's still going between different hospitals because they can't even identify what the bug is. So they keep treating him with different antibiotics, IV. They are giving him hormones. But what I'm trying to say here, that if they knew psychiatry the way I knew it, and we keep teaching people again and again that if, brains of the internet, listen, if there is a sudden change of a mental state, especially if a person is in and out, we call it delirium, it's a life-threatening, pay attention, physical, not psychiatric, physical situation, okay? I'll give you another example. Somebody is walking on the street and all of a sudden you see them fall. What do? You bring them to the emergency room. What they are going to check first, a couple of things. Blood sugar, right? Because if somebody has
Right.
diabetes,
Blood sugar.
right,
If you're hypoglycemic, if your blood sugar drops, it'll cause changes in your mental status.
right,
Also, they have to image. They have to check what's going on with a CAT scan or an MRI.
right.
It's really important.
All right. So you see, so there are a lot of things which people can do, make mistakes,
Mhm.
and then depending on how the patient is, how the relatives are, they can get sued. This is whether we like it or not, but this is appropriate, right? Because I mean, somebody made a mistake. Left arm, right arm, amputating a wrong leg, missing a delirious state, not paying attention to seizures, blah, blah, blah. But Dr. Diamond, have you ever had a situation when everything went okay and you still weren't sued, but were in trouble? People yelled at
Oh,
you.
sure.
Could you give
A
us an
lot,
example?
several times.
Okay.
Um, let's see. There was a patient who was progressing well, who came to our rehab floor
Right.
after a brain tumor removal.
Okay. Rehab in this case is not about drug rehab, right? Rehabilitation means helping people to get back on their feet, right?
Right.
So they remove the tumor from the brain.
hmm
Right.
And then the goal of coming to rehab is to optimize their function to try to get them back to their baseline.
Right.
So after you have a brain tumor, you have some neurologic deficits. You're not able to walk. Maybe your personality changes depending where the tumor is located. And then post-operatively, you want to try to help those patients rehab back to their normal lives. In this case, the patient was doing well physically, was meeting
Right.
the goals of physical therapy. Every week, we'd have meetings on this patient to see if they're progressing the way that we want them to. And this patient was doing great, but the brain tumor actually, there was a recurrence. It was a very aggressive type of tumor. Have you heard glioblastoma?
Of course.
It's one of those tumors where it just comes back very quickly and you can't really do much about it. The
Senator
prognosis.
McCain, for example, remember?
Which,
Senator McCain
right.
died from glioblastoma.
Yeah, if
Yeah.
you get that diagnosis, it's not good.
Right.
But the tumor came back and the family started blaming the rehab team.
Right.
So, in certain situations, there's not much you can do, but you just get this abuse because there might be a lack of awareness from the family. They just don't understand that it's out of your hands as a medical professional, and it's the way the disease is.
Right. So, yes, go ahead.
Are there things that is it to the point where you feel like it affects how you do your job because you're always paranoid that somebody will come back
Oh
and sue
yeah,
you?
there's something called CYA,
Which is?
cover your ass.
Right.
um, Yeah, doctors are totally worried about this situation. They're worried about families, patients just coming back or electronic medical records too have made this a lot worse because now there's a play-by-play of everything you do, and say initially you don't want to order a test because you think it's something and you're planning to do it later. If you
Right.
don't document that you were thinking that, lawyers go back and they look at the record, they can ask you, why didn't you do that? This is a job on you as a physician. So now doctors are ordering more than they might have initially.
Right. Like, for example, I'll give you the same example. Somebody falls. So, for example, my generation, we would go for checking blood sugar. If blood sugar is extremely low, we would replenish it, meaning give them something that brings it up. Most of the diabetics are told to carry around candy or even plain sugar cubes because they then take them and they feel better. So we would do that. Let's say in the 70s, in the 80s in Moscow, that would be the end of it. A person comes back, goodbye. Right now, you heard what Dr. Diamond said. Absolutely not.
No way.
EKG, full blood work, CAT scan of the brain,
Mhm.
maybe an MRI of the brain, right? What
Oh,
else?
You have to
Maybe a
check their
consult with a
glucose,
neurologist,
endocrinology consult,
endocrinology consult.
glucose checks every 4 hours.
Right.
It's
That's why, like,
overkill.
every time I go to a doctor, I feel like I'm getting 15 tests. Like, I'd be like, oh, I have the sniffles, and I get
Right.
like 15 more tests in
Right.
any given situation. So it's just like cover your ass
Oh,
like,
yeah.
across the
It could
board.
be
That's crazy.
anything.
So,
That's cool because I was convinced my doctor was a vampire or something. The way she
Right.
draw my blood every
Right.
single time.
So I'll give you an example, a very, very recent example. I saw somebody yesterday, actually, who didn't come to see me last week. And the wife called and said that he had cardiac surgery. So what happened with him was this. He is in his 70s. And he developed, he knew that he has diabetes, which is poorly controlled because he eats, he likes to eat and doesn't care, right? He knew that he has blood pressure issues and he knew that he has some heart issues. So all of a sudden he developed pains in his chest, didn't want to go to see a doctor. Finally, they forced him to come and see a doctor. The doctor said that, with the kind of complaints, meaning what you say you have, I have to send you to the hospital. Send him to the local hospital. We have this tool in medicine, Dr. Diamond will tell you, when we do blood work to see whether a person has a myocardial infarction. How do you call this test?
Troponin.
Right. So it's
a
free.
marker. It's a
Yeah.
blood marker that shows whether there's cardiac damage. So if you're having a heart attack, you'll spill troponin. That's what they
Right.
call it.
Yeah.
And if it's a certain number, if it's elevated, that indicates that you're having a heart attack.
Right.
And
So
then
they did this test. It
It's
was
called
negative.
troponin. I'm sorry.
Yeah,
troponin. Yeah.
Trip
So
on-
it's basically like an enzyme in your heart, and it functions. It's a protein. It functions to like help the cardiac contraction. So it's normal, but it's supposed to be a certain amount less than like 0.1.
Right.
But when there's cardiac damage, a lot of that will spill. So if your heart's just not working properly, a lot will release into your bloodstream. And it's a really fast way to see if you're having an acute heart attack.
Right.
Sounds
So
like
they
a new
did it.
SoundCloud rap. or
So they
something.
did it. It was, as we call it in medicine, negative, meaning it was normal.
Mhm.
They did an EKG. It was normal. So he was seen by a doctor. And before that, he waited in the waiting room for a long time. So the doctor said, similarly to what the ambulance people said, formally, we are not seeing anything, but I feel uncomfortable letting you go. Why don't you stay overnight? He stayed overnight, was seen by another physician who said that, we need to do a stress test. So it happened on Friday night. A stress test is when they hook you up to an EKG machine and you run on a treadmill.
Yeah,
Do you agree?
that's
Yeah.
accurate. And then they just
Okay,
check
so
your
if you
EKG.
have some heart problems, they're going to be able to see it on your EKG. But they said we can do it only on Monday, so we are going to keep you until Monday just in case. The guy was very unhappy about it. His wife was very unhappy about it. So the next morning, another physician came around and said, you know what? Nobody finds anything wrong with you. We just feel so uncomfortable letting you go. Why don't we do another set of tests, which they did, it was negative, and why don't we try to record your EKG continuously, meaning nonstop? And while they were recording for about 20 minutes, they saw signs that could have indicated that he has an issue with his heart. They said to him, look, we need to look closer. So they wanted to insert in one of the arteries a probe that goes all the way to the heart. Dr. Diamond will tell us how it's called.
Catheterization.
Yeah. So they want to do cardiac catheterization. And while they were doing it, for seemingly no reason, they found that his main cardiac artery was 100% blocked, meaning
Wow.
they
That's
caught
bad.
him in the process of developing a myocardial infarction during the recording of the EKG, which happens, I don't even know how frequently. I mean, he was lucky that he was hospitalized. So they put 2 stents in his heart. Can you explain what the stent is?
A stent, basically, it just opens up the artery. So it's like a metal application.
Spiral,
Yeah.
right?
Just kind of like a tool. If you think of something that's blocked, you're putting it into a tube to open the
Right.
obstruction. And then it allows for the blood flow.
So he went about his business happily ever after.
It's a lucky guy.
Right. So an opposite story. Is he going to sue these physicians? Probably not. Right? But at any step of what happened, there could have been a misstep, right?
Oh yeah.
And Dr. Diamond is looking at me with her eyes wide open. And I looked at him because I don't, so these people were so experienced that they suspected that there is something wrong. They couldn't put a finger on it, right? Because there was absolutely no reason to believe, like he didn't have typical pains, right? So people get sued all the time and for no good reason, right? We gave you examples when things went right, but Dr. Diamond just told you that now people are having problems with rehab physicians who have nothing to do with surgery, right? And in some cases, it's impossible to do surgery the best way possible.
Right. There's actually another issue that I thought of when you just brought up this
Right.
case. Nowadays, you have to prove to hospitals why you're keeping a patient admitted, and they want to discharge patients as soon as possible.
To the insurance company.
Right. So now that when I think about this patient,
Right.
I'm surprised that they were able to keep him for 3 days,
Right.
even if they thought his workup
No,
was
it turned out to
negative.
be 2 days because the next day he developed it. Right. So it could have been that the insurance company would have told them to discharge him.
Right.
And if they discharged him and he died or developed complications, guess who would have been sued? Not the insurance company.
The physician.
The doctor. yeah.
Right.
Right.
How aggressive is like the insurance company? Like, are they actually calling you on
Oh.
the phone? Like, why you have this person? Like,
Yeah,
send them
very
home?
aggressive. It's something to do with the social workers and the case manager, and everyone works as a team, but they pressure the doctors to discharge patients before they're ready. It's a common problem.
Yes. So, which brings about another issue, which people are probably not aware of. Now we have to hire significantly more people who work with us around these issues. Like, for example, in my private office, here, and I'm a psychiatrist, remember, so I have zero equipment, right? I just see patients. Hi, how you doing?
You have
Right?
that brain machine. The
No, but
neurofeedback.
normal psychiatrists don't have brain machines. So I see
This is
people,
special psychiatrist guy.
I interview them. So I have a front desk person, right, who says hi, bye, takes phone calls and schedules. But also behind the scenes, I have a person who deals with insurance companies to get either an approval for people to be seen or just to check on whether this person's insurance works. Then I have hired a billing company who takes a significant percentage of my income from me for providing billing. Like
Wow.
it should have been, everybody has it now. The hospital in which you work has a
Oh,
huge
yeah.
billing department. I used to be chairman of a large department of psychiatry. Let me ask you, in your opinion,
Mhm.
what is considered to be a good collection rate for the hospital?
Oh, that's above me right now. I'm just
All
in
right.
my
So
residency.
collection means you build 100%, right? You build for $1 million. What is considered to be good? Hermes.
I feel like they're at least gonna get like 60%
Okay.
out of you.
How about 20 or less is considered
20?
to be
Wow.
good? Yeah.
You telling me I don't have to pay my hospital bills for the rest of
No,
my
no,
life?
no, no, no.
and
They just
enjoy
don't
it?
get. They just don't get paid.
Yes, it's the status quo.
Not
Like, I'll
not
pay
by
you
not
later,
by
and then
clients,
bye.
by insurance companies.
Oh, really?
Right. Yeah, yeah, yeah,
Oh, I
yeah.
think you just mean like
It's a
broke
struggle.
people
Yeah,
just
yeah, yeah.
don't
So
pay.
plus,
Oh, that's crazy.
constant audits are conducted, both for private physicians and hospitals. Rates are continuously adjusted. Or, for example, even I had cases in my practice, and a lot of physicians, you want to become what kind of physician? What specialty?
Pain management.
Pain management. So forget about it. This is a disaster. She's going to be audited all the time. And
Oh,
they can
boy.
tell her, look, you just administered an injection, right? And you wrote about it in your chart, but we are not convinced, so we are not going to pay you. Or they'll pay you, and then they take your money back.
How'd that work?
I don't know. That's just exactly how I said it. You understand, right?
That's just such a crazy finesse. It sounds like.
Yeah?
uh,
Does it sound crazy to you?
I feel like I'm broke, so I pay the insurance company to cover me.
Right.
And then when it's time to cover me, they tell you they're broke, and I don't get it.
No, they don't
just
say
keep
they're
broke.
broke. No. They say that documentation doesn't
Oh,
support
yeah.
the procedure. Like you shouldn't have done it, right?
But you still gotta pay your insurance.
You
Right.
feel me? I'm just confused. I didn't know this was
You
happening
really have
the
to
whole
prove
time.
to them. You really
Right.
have to like make a case that the patient needs it.
Right.
If
By
you,
the way, guys, the situation is so funny that you just heard a comment that came neither from Hermes nor from Dr. Diamond, not from me. It came from our recording genius with Nell because he couldn't help himself. And please leave it in because it's, I mean, this is your normal reaction, right?
Right.
Right.
That's crazy, bro. That just sounds.
You agree?
Yeah, I don't even know how that's possible.
No, but
Agree with it.
doesn't sound like abuse to you?
Oh yeah. Like you guys are getting swindled.
Okay. So you can argue, for example, around psychology and psychiatry, right? Because I say potatoes, you say patatas. But when it's surgery, pain management, right?
right? You have to meet that criteria. If you don't, you're just not making money. You're losing lots of money.
Yeah.
And then this creates problems because doctors aren't able to pay their staff. They have to start seeing more and more patients. So suddenly they're triple booking. Patients are waiting for extraordinary amounts of time. Things are getting missed. It's not your normal lengthy patient encounter. It's cut down to like 5 minutes. It's a lot of things that happen because of the insurance companies.
Yes. Well, I don't do shorter stuff, right? But and I'm not here to complain about my private practice or anything like that. But it has been very difficult because you need to hire significantly more staff you need to deal with insurance alone. Like for example, let's pretend that you have insurance which is called music, right? Insurance like that does not exist. So I'm
Music
just
insurance?
making it
We
up,
must have to
right?
make it up because these
Right,
insurance
right.
companies make
Okay.
money out here.
So it's called music, but this music insurance has up to a few hundred subdivisions. So your plan with music could be different from my plan with music and from her plan with music and with his plan with music, plan with music. And all of that has to be taken into consideration and somebody has to work with it. It's a lot of bureaucracy there. You agree?
Oh yeah.
Okay. Have you ever been physically abused by anybody? Or emotionally?
Oh, definitely emotionally.
So can you give us an example?
Let's see. Well, I've gotten emotionally abused by nursing staff.
Okay.
Just getting paged throughout the night.
Yes.
Patients need something that could have been done like in the morning. They'll page me at 2 a.m.
Right.
Now it's gotten better. Now that they know me, we became friends. But I mean, that was a big issue. I think there's just such a disconnect in the medical profession that no one really gets what everyone else is going through or dealing with.
Right.
So,
So she's hiding like certain things from you. So we have a resident here. So when you graduate medical school and you're done with your internship and you passed your boards, depending on your specialty, you have to do between 2 to 7 years of residency training. The longest training is probably for brain surgery, which also has one of the highest malpractice insurances, naturally, right? Okay, so when you are the first year intern, first year
Intern.
resident, you are basically a slave. You probably haven't read about it because, I mean, who cares? But there used to be that they had to stay inside of the hospital for a few days. What was the maximum? I
I think
don't
it was
remember.
like 48 to 72 hours.
Right.
We
When
were
I was in the
working
residency
straight.
training in psychiatry, my regular on-call day would be like this. I would come at 8 a.m. in the morning. I would work until whatever is the end. And then I would stay over all night, receiving multiple calls. Then in the morning, I would take a shower because we had an on-call room and go back to work and leave at the end of the day.
Was it like a messy episode of Grey's Anatomy?
Right. But it's probably accurate.
Grey's Anatomy?
Right.
Because I don't know. Their
No,
lives
it's
seem kinda
probably
crappy.
accurate, right? So in surgical specialties, people would stay for a few days without going back home.
They didn't get to take a shower.
Right. So this is another case. I mean, if you talk to people who designed it, they'll explain to you why they did it, right? But it makes absolutely no sense for somebody to work that hard. The reason behind it actually is a money-making machine, because although if we named, which we are not going to do, how much resident gets paid, for a bunch of people who get a minimum wage, it's going to sound, pretty good, but actually it's not. Because I don't know about you and whether you want to disclose it or not, but did you have to take a loan to go to school?
Yes.
So once you graduated, are we talking about a few $100,000 that you owe?
Mm-hmm.
All right.
Before interest.
Before interest. So she'll wind up paying back an enormous amount of money. I mean, there's nothing to complain about because going in, you knew about it, right? So you signed up for it,
Right.
correct?
That's true.
Okay. Maybe there was some, yeah, okay. So since I'm older and since I'm in psychiatry and since I'm also originally from the Soviet Union where I worked, so I was a physician's assistant. I worked in poison control ICU in Moscow in a place similar to Bellevue. I worked on the ambulance where they had physician assistants. History of people trying to abuse me is endless. I could have written a book. Nobody's going to read it. But I'll give you an example from my residency training here once. So I was interviewing this petite woman who was high on crack. And she had schizophrenia. So she was actively hallucinating
Is
in
it
front of
Moscow?
me. Huh?
Is it Moscow?
No, here in the United States. So I was sitting across the desk from her, and there was a humongous security guy in the room. That's what they had at the time at the hostel where I worked. At some point, responding to her voices, she leaned across the desk and slapped me in the face, across the face.
Make sure
And
you're still
then,
awake, right?
and then she ran away.
Oh.
And I asked the security guy, "Get her back." He said, "Didn't she just slapped you?" I said, "Yes, but she's a patient. She didn't know what she was doing." And I was right. They brought her back to their enormous surprise that I want to talk to her. She actually was psychotic, so I didn't take it personally. But I've had numerous cases in my life when people cursed at me because I wouldn't give them Xanax, right? Because I wouldn't prescribe medications they came from the street to demand from me. Or if they would come to my office and they were obviously apparently high, and I would ask them to submit urine for drug testing, and then would tell them that they were on cocaine, on heroin, and on methadone together, and they would start cursing and yelling, right? And do we have internet right now? So guess what people do? They
Or
write
leave reviews.
they write bad reviews, but they would never say about what actually went on. Like, for example, I had a case a few years ago when a patient of mine, who I knew, right, for a while, a very intelligent woman, came to see me on the day when they had a Christmas party at the office. She was tipsy. I told her, "Look, with your medication selection, it's not such a good idea to drink alcohol. And, with my Russian accent, you would presume that I would be all for it because allegedly we drink vodka all the time."
Mhm.
Which is
That-
probably true. Right? Right. And she kind of like was all smiles with me. We had a long conversation about it. And then she needed to make an appointment. And we already let, because it was like before holiday day, we let our front desk people go. So the practice manager was there. was very sophisticated. And she started calling her names and cursing at her, right?
Your project manager. Your
My
patient started
practice
to
manager.
curse-
So I
yeah.
came out of the office
Yeah.
and I asked her to leave. And I told her that she needs to apologize, which she refused to do, cursed at me, and left. The next day, she wrote a review about practice manager verbally abusing her, which was totally not true. And guess what? It took us a few days to convince people who are responsible for reviewing these reviews to take it down. Do you think they did take it down?
No.
No, they didn't.
Yeah. No.
And you know why they didn't? Because they said that everyone has their own perspective and people have a right to read about feelings of this person. Okay? And when I kept pushing them and telling them that it's so inaccurate and we have it recorded in the chart, they said, well, you cannot have only positive reviews if your score is 5.0. People don't believe it. So it's good that you wrote a negative review. Think about it.
What?
They treat it like what, like Instagram likes? So you think you bought your reviews? I don't get it.
Well, it's not the Instagram. There is a particular website. We're not going to talk about it.
Oh, okay.
Okay.
So
All right.
a couple businesses Hermes gonna open this
Okay.
weekend.
So what else are we missing here with abuse? So we discussed insurance companies that protect us, constantly raising the rates. So since OBGYN gets sued a lot, the rate that they pay, meaning the amount of money they shell out to insurance companies, is the highest.
Right.
Right?
Malpractice insurance.
Malpractice insurance. It's hundreds of thousands of dollars. So guess what? They have to pass the cost on to you. I mean, you, Hermes, are
I don't get
safe,
sick
right?
or-
You are God,
Mhm.
and you cannot give birth. And if you wanted to have children, you would just snap your fingers and have.
Yeah.
Yeah, so it's
it's
no
just a
big
quicker
deal.
process.
Right, but they pass the cost on to their patients. I'm guessing. Actually, cost of malpractice in psychiatry is relatively low.
Really?
Well, how can I hurt somebody?
It's all subjective, right?
No, but no, like seriously, maybe emotionally, right? Somebody might feel uncomfortable with
Hurt
it,
their feelings. Stop
right?
yourself.
But
Stop
yeah,
thinking about-
right?
Yeah, I mean, the more procedures you're doing, the higher liability. So the bigger risk, the more you have to pay, just in case something goes wrong.
Right. So I suggested to you, Dr. Diamond, to do it. Not because we wanted to complain to people and tell them how difficult our life is, but I wanted people to appreciate the fact that when they come to see one of us, they should be a little bit more polite. Like, for example, I'll give you an example. In my fancy schmancy office, during winter time, I ask people to take off their coats and hang them. These coats are constantly watched by the front desk staff. I have a really nice office. I'm dressed in a jacket. Even right now, I'm dressed in a jacket, right? So it's like my second home. I spend most of my time there. And people refuse. And then I tell them I'm not going to see you.
Really?
Yeah,
You
yeah.
said that on that basis alone?
No, wait a second. What's the big deal? When they go to a dentist, are they going to complain? Or if you go to have an MRI done, have you ever had an MRI done?
Mm-hmm.
Right.
It's the
So
machine thing, right? With the two.
yeah. But
go
they
inside,
bring
yeah.
you to the place where you change in scrubs because you have no choice. Why can't you take off your dirty coat and sit in my luxury office?
It's cold. I don't know. It's breezy. You know,
In my no.
you pay for that heat. As when the heat bill comes in every
No,
month.
but
you're
I
like,
said
"There's
that
no reason
that
I'm
to
gonna pay this."
me,
Mhm.
it's either an indicator that the person is way too difficult for me to handle,
Mhm.
and I'm going to talk about this issue together with
Difficult
Dr. Diamond.
patients.
Right. Or I don't even know what to think about them. So I think that we have to have a mutual respect with people. Dr. Diamond, what
Yeah.
do you think?
I think that's totally fair. You know, it's a mutual relationship. Patients are coming to you. They should be respectful
Right.
and follow those rules. In hospitals, you have to wear gowns. If you're wearing your clothes, you can't get your blood drawn. You can't participate in physical therapy in my field. Sometimes patients are resistant. They don't understand the reason behind things, why certain rules are in place,
Or, for example, I can tell that I've had cases in my life in certain locations when during the summertime, female patients come almost exposed to the appointment with me. And then I have to invite a female staff member into the room, because the next thing you know, I'm going to be accused of sexual harassment or God knows what, which also weighs on me, right? And some people say, why do you invite another person? I tell them, I don't know how to put it to you. So I actually
CYA. I think
No.
Dr. Diamond gave us the term.
no,
earlier.
but in some cases, I asked my female staff member to take this person
Oh
aside
yeah, you
and
have
explain to them that they're overexposed, because I can't say it to them. It's going to be considered abusive. In one of the offices where we had a very high volume of drug addicts and people with questionable lifestyle, we actually bought robes, and in case male or female would come in a wife beater's t-shirt or like overly exposed, a staff member would come and tell them, if you want to be seen by Dr. Schultz, you have to put it on.
How do patients take that?
Some didn't care, some did, but I can't do it. We are in the United States in 2019. Are you kidding me? Right?
Hear you.
Do you agree?
Oh yeah, me
So
too.
so I would ask people to be respectful to us and understand that between them and Dr. Diamond, between them and Dr. Schultz, and between them and Dr. Smith and whoever, there is a multitude of people who are standing in the way of us having a normal, productive relationship.
Right.
Do you agree?
Mm-hmm.
Anything else you would like to say, Dr. Diamond, before we close this discussion?
I just, I think there's a lot that the general public just doesn't really know, because it's hard to get it if you don't go through it. And if you
Right.
don't, but a day in the life of a resident or attending doctor in New York City, and you'll have more appreciation for all the abuse.
On this positive note, as always, I suggest, please keep your brains
wide open.
Yeah. Thanks for tuning in to another episode of Brainstorm 9000. If you like us, love us, or marginally tolerate us,
And definitely, if you hate us,
then go on social media and give us a review on Stitcher, iTunes, or YouTube, or wherever you listen to us.
and remember,
Keep your brains open.